Hi, Nicole. My name is Julie. I'm going to do your mental health assessment video peer review. I just want to start by saying I found your video to be excellent, very informative. I want to also start by applauding you on your speaking skills. I thought you spoke very clear, very confidently. You never said at all in your video, and that's something that I struggle with when I speak, on a video or in person. So I thought that was amazing that you can speak like that without saying. So great job on that, just to start. Couple of highlights for your video. You did a great job introducing your body system assessment and how it's used. You gave great examples of normal findings and abnormal findings. Some of the examples that you gave for abnormal, I really found to be, helpful, and that was a great assessment tool. Was that you explained that, about emotions, if you're assessing a patient and they have a very flat affect or they're very withdrawn from the conversation, not only is that an abnormal finding, but linking it to, maybe depression or something else, related to mental health. So that I thought that was a great way of explaining, and comparing your assessment findings. I also want to point out an example that you gave that I thought was incredible to include in your video. You were talking about, assessing patients' motor habits. Are they ticking? Are they fidgeting with things? Are they tapping their foot? Again, not only is that an abnormal finding, but going further and, why is that? Why are they doing that? Is that, a side effect of their medication, like tardive dyskinesia, like you mentioned in your video, or is that, something else that's, something internal like Parkinson's or Tourette's? So I thought you did a really great job explaining that and giving great examples and things like that in those two areas. I also want to point out that you did a great job explaining, health promotion at the end of your video for mental health for your mental health assessment, encouraging safe relationships, a healthy diet, and healthy coping mechanisms. And for that, you gave, examples of unhealthy coping mechanisms such as alcohol and drugs. I thought maybe on the contrary, you could have added some healthy coping mechanisms just to show the other side as well, such as walking or, something like that. Another thing that, maybe you could have done differently for your video is maybe recording, actually performing the mental health assessment, on someone instead of just, explaining what the mental health assessment is, by itself. Though I did find your video to be extremely informative as it was. I'm a visual learner, so I know that, maybe it's for other people as well, seeing the assessment tool actually being used on a patient could have, maybe gotten an extra step of, being like a good tool, a good way to show it being used, for, education. Other than that, I thought your video was great. You did a really great job researching it and making sure you hit all the points of, mental health assessment, all the different aspects, orientation, emotions, their motor habits, appropriate responses to conversation, appropriate emotions, to situations and, in the conversation, things like that. It was very thorough, very well researched. You spoke great, very clear. And yeah, it was a great video. Thank you.